You've probably heard people use the term brain fog, or you may have used this term to describe times where you feel like your brain function is a little off. Sometimes we talk about symptoms like trouble concentrating, a sense of forgetfulness, issues with reaction time, fatigue, confusion, maybe even problems finding the right word. But brain fog isn't actually a medical term, it's a general term for a range of common subjective brain issues. What is causing people to experience these issues that we describe as brain fog? I'm Dr. Austin Perlmutter, and in this video, we're going to be addressing the potential drivers of the symptoms of brain fog and what we can do about some of these problems. I'm a board certified internal medicine doctor. I create content to educate people on brain health, and if you're interested in this content, please subscribe to my channel. Last point here, general disclaimer, this is for educational purposes only. This is not to take the place of medical advice. Okay, let's jump into the conversation around brain fog. What are some of the drivers of brain fog? What can we do to prevent and manage some of the symptoms and drivers of brain fog? As I've mentioned, brain fog is not just one specific thing, it's a constellation of symptoms related to the brain. To this end, it's important to understand that many different things can contribute to the experience, to the development of brain fog. And that ranges from things like infectious diseases, to changes in hormones, to vitamin deficiencies, to medications that includes pharmaceuticals, as well as over-the-counter medications, as well as alterations in our immune system. While there are many different things that can contribute to brain fog, we can focus on some of the top potential contributors to this state. And I would like to just say that certain of the contributors to brain fog are things that you really do need to seek medical attention to fully address, and some of them are things that you can do on your own. The first of the drivers of brain fog issues, not surprisingly perhaps, is mental health issues. So, mental health issues are kind of by definition brain issues, and many of the things that we generally characterize as part of a mental health diagnosis is actually or are actually things that we would consider symptoms of brain fog. For example, in major depression, one of the diagnostic criteria is that people tend to have trouble concentrating, but that's actually also something that people will experience when they're experiencing brain fog. We also see trouble concentrating in people with generalized anxiety disorder. Brain fog, when it's coupled with something like a mental health issue, could be driven by a number of different factors. We get to the question of what actually is driving mental health issues, and we know that it may relate to changes in inflammation, metabolic pathways, stress pathways, as well as changes in neurotransmitters and neurotransmitter receptors. There's a lot to talk about here. We'll talk a little bit more about some of the stress pathways in particular and endocrine changes that occur alongside those stress pathways. What should you do about mental health? Well, clearly mental health is something for which there are many different treatment modalities available. If a person is experiencing significant mental health issues, the best bet is to seek professional care. Things we can do to help to decrease our chances of developing mental health issues and potentially help mental health using a lifestyle framework would be to make sure we're prioritizing good sleep, good diet, good exercise each day. And some of the things that have been in particular shown to benefit mental health, mostly around depression, that may also relate to brain fog, would be dietary changes that are closer to a Mediterranean pattern diet, which has actually been shown to be effective both in the treatment of depression and in the potential prevention of depression alongside a number of other brain-related issues. So the first one here we talked about was mental health issues. The next one we're going to talk about, the next kind of condition that has a lot of overlap with brain fog symptoms and one that is growing in terms of the number of people who maybe could attribute their brain fog to this, is long COVID. Right now, based on the most recent literature, the most common driver of brain fog symptoms seems to be long COVID. So long COVID is a condition that occurs after a person has COVID, and it affects about 400 million people around the world. What are the things that are typically described when people experience long COVID? Well, some of the most common issues are trouble concentrating, memory issues, and confusion. Now, I've written about long COVID. I've published research on COVID in particular and the overlap with mental health issues, but many recent publications have actually described improvements in long COVID-associated brain fog with certain treatment modalities. These include non-invasive brain stimulation, hyperbaric oxygen therapy, and potentially treatment with a combination of fatty acids plus antioxidants. So we're learning now that there may be some ways to specifically target the brain alterations seen in long COVID. And one thing I'd like to say here is, in the context of the larger pandemic, something that we saw is an overlap in symptomatology, specifically brain symptomatology, between people who had an infection and people who were simply being affected by lockdown measures, the stress, the poor diet, and other factors that can contribute to worse brain health. So, point here is that long COVID seems like it's a significant contributor. We're still learning how long COVID can be managed using a variety of modalities, some prescription, some non-invasive brain stimulation, some hyperbaric oxygen therapy, and some nutritional supplementation. But appreciating here that the connection is between immune activation in the context of an immune issue and these brain fog symptoms. The next domain we're going to talk about in terms of potential contributors to brain fog are endocrine or hormonal imbalances. So I alluded to this earlier in the context of mental health issues. We know that stress pathway alterations have significant impact on our brain function. That's actually how stress works. It actually causes us to see the world in a different way. When stress is constant, when it becomes chronic, what you get are alterations in the hypothalamic pituitary adrenal or HPA axis, and changes in other parts of our bodies as a reflection of these alterations. Now, HPA or stress pathway changes in the brain may actually be related to many of the symptoms of brain fog. It's actually been known and clear that when the HPA axis is dysregulated and cortisol is elevated, that there are alterations in cognition. We also know beyond the HPA hormones that alterations in thyroid hormone can actually lead to experiences of brain fog. And in particular, what we see is that people who have hypothyroidism, meaning they have low levels or lower than anticipated levels of thyroid hormone, that there are higher rates or incidences of brain fog symptoms. In terms of some of the things that we see in addition to this, there are hormonal changes that are seen alongside blood sugar issues. So these are things that we would see potentially in diabetes. If you have a very high blood sugar or a very low blood sugar, that clearly can alter brain state. But we're also learning that if our blood sugar levels are too variable, meaning they go up and down more than we anticipate, that may actually translate into risk for brain issues. So when we're talking about endocrine issues, hormone issues, there are a number of different hormones that may contribute to brain fog. For all of these, I think it is helpful to seek professional care if it's becoming a major symptomatic issue. Now, granted, if you're experiencing stress and that's causing you to experience brain fog, there are certainly things you can do at home. That includes practicing mindfulness. Even exercise can be helpful in helping to mitigate stress. But in particular, if we're looking at concerns around diabetes management, thyroid hormone tests, these are things that really benefit from lab-based analysis to tell you about how you're doing in terms of management and whether you might be a candidate for getting medical care. Okay, let's move on to another subject, which is sleep problems. Now, sleep problems are one of the things I talk about the most because sleep has such a direct impact on brain function. And I think, I'm certain I can experience this in myself, you probably can experience this in yourself. When you are sleep deprived, your brain just is not going to work the way that it usually does. Similarly, if we get good sleep, it can have such a rapid and beneficial effect on our brain function. It turns out, not surprisingly, that poor sleep can actually lead to just about every symptom of brain fog. In a 2017 study, researchers found that some of the symptoms of brain fog were driven by impairments in communication between neurons when we're poorly rested. What does this mean? Well, it means that when we get good sleep, it helps our brains to function at a higher level. When we don't get good sleep, we're impairing memory processes. We're impairing neuroplasticity. We're making it harder for our neurons to send data between each other and to wire themselves in a healthy way. Beyond just working on getting better sleep as a strategy to mitigate brain fog and also to help to perhaps prevent brain fog, people with too much daily drowsiness, with consistently poor sleep, with other sleep issues, may really benefit from seeking an evaluation with a sleep study to test for conditions like sleep apnea. Sleep apnea, restless leg syndrome, and other sleep disorders are actually quite common. Now, You can get some biometric data from certain wearables, the Aura Ring, the Whoop Band, to give you a sense as to whether you're getting good quality sleep. But as a healthcare practitioner, I would say healthcare practitioners would be interested to hear from you that you had concerns around your sleep. And this is something that most primary care doctors are able to look into quite easily to basically see if you qualify for a sleep evaluation. One of the things that's really relevant here is if you have a condition like sleep apnea, there are absolutely effective therapies that can improve the quality of your sleep and therefore improve your cognition to help decrease sleep related symptoms of brain fog. Let's now move back into the connection between brain fog and immune alterations. So let's talk about autoimmunity, allergy, infections. The immune system, simply put, is one of the most significant systems in terms of modulating brain function. Your brain has about 10% of its cells that are immune cells. And this helps to explain why, as I mentioned before, brain infections or infections that can lead to brain symptoms like long COVID are linked to symptoms of brain fog. But it also allows us to understand why so many people who have conditions like autoimmune disease, including multiple sclerosis and lupus, but also people with significant allergies and people with infections tend to have brain fog. Think about the last time you were sick with an infection. Let's say you got a cold, let's say you had the flu. Chances are your thinking wasn't super clear. And the reason to this is because when our brain's immune system is activated, it can lead to alterations in cognition. Beyond this, something that most people do not understand is that the immune system is an incredibly energy intensive system. At the highest levels of immune activation, for example, patients in the ICU with a condition called sepsis, which is basically a diagnosis when a person has a super revved up immune system, that can actually be using up around 50% of your body's energetic demands. When you couple that with the fact that the brain by itself uses around 20% of the body's overall energy, you see how there could be issues because now you have multiple competing energy demands. We also know that when the immune system is activated, it creates molecules that alter brain function. So specifically molecules called cytokines, which are immune signaling molecules, can change the way that our brains function. So when our body is experiencing an immune activation event, or for example, chronic inflammation, that may actually cause our brains to have different experiences and different ways of thinking because of these cytokines, these immune molecules. For people who have significant concerns around immune issues, let's say you're worried about an autoimmune disease, this is a great scenario in which seeking medical care is a good next step because there are specific tests that you can do to diagnose those conditions. But what if you're somebody who is concerned about, let's say, brain fog that comes up from allergies? Seasonal allergies, not a huge deal. There are a number of things that you can consider. Allergic avoidance, meaning avoiding your allergens. So over-the-counter medications can be helpful, with the caveat being here, certain over-the-counter medications, when taken at large doses and for long periods of time, can themselves create brain fog. And I'll highlight here anticholinergic medications like diphenhydramine, better known as Benadryl. Yes, it has an anti-allergy effect, but it can also have additional effects, specifically sedation, that can lead to a person's symptoms of brain fog. So a non-sedating antihistamine may be a better bet than relying on some of those more potent medications if the goal is to avoid brain fog. Generally speaking, back to this point of kind of immune activation, many of the things that contribute to low-level immune activation in the body, which we would call, I guess, inflammation, chronic inflammation, can be mitigated with a generally healthy lifestyle, which means getting good sleep, exercising regularly, engaging in stress mitigation, and prioritizing real healthy food. So bottom line here being that immune activation can pull energy from the brain and influence the brain through these cytokine pathways, activating the brain's immune system, contribute to symptoms of brain fog, and some of the strategies to help to target that will relate to degree of severity as well as potential for seeking medical care for some of those more significant conditions. Let's now pivot into a condition called chronic fatigue syndrome. Now, this is also known as myalgic encephalomyelitis, and it is defined by physical and cognitive fatigue symptoms that last for at least 6 months. People who have chronic fatigue syndrome are often describing the exact symptoms of brain fog. So what is causing people to experience chronic fatigue syndrome? Well, it's a complex condition. I don't think that we've really established exactly why people get this and what is necessarily the fix for this condition. But some of the things that appear to be linked to the experience of chronic fatigue syndrome include alterations in blood flow to the brain, decreased activation in parts of the brain, chronic immune activation, and poor sleep. If you are concerned about significant symptoms related to chronic fatigue syndrome or myalgic encephalomyelitis, again, those are the same thing, I think this is really a good scenario to seek medical care because some of these people who are experiencing this can actually get benefit from pharmaceutical therapy. So now let's focus on, I guess, the other side of the coin, which is what happens with some of the things that we use to treat other conditions. And this is really focusing on medications. As I've alluded to before, certain medications, and that includes prescriptions and over-the-counter medications, have brain-specific effects, and those can actually lead to symptoms of brain fog. What are some of the most or worst offenders when it relates to prescriptions and over-the-counters for brain fog? Well, one of the worst is actually over-the-counter sleep aids. I brought up diphenhydramine. Again, I think that is a very important prescription. That's the, or over-the-counter, that's the generic name. There are many brands that use diphenhydramine. Benadryl is probably the best known. But diphenhydramine is a sedative anti-allergy medication, and it can lead to symptoms of brain fog. Another group that is important to note is prescription sleep medications. So prescription sleep medications, many people rely on for sleep. Sometimes they're helpful, sometimes they're beneficial in a short amount of time. But especially if you're using these where you don't actually have a prescription and you're not addressing your underlying sleep issues, this is a risk not only for development of dementia, but also it can contribute to brain fog. Clearly, another class of medications that we should pay attention to are pain medications. So more potent pain medications are known to create symptoms of brain fog. This isn't to say that people shouldn't use prescription pain medications. It's just to be aware that sometimes they can actually have this side effect, which is to create symptoms of brain fog. Some of the main considerations to pay attention to here are just generally to be cautious around your over-the-counter medications. Make sure you really need them. Just because it's over-the-counter doesn't mean it isn't a potent drug, and to make sure you're working with your healthcare practitioner to know that they know what you're taking and to also understand that you may have these symptoms. So if you're experiencing brain fog symptoms, to let them know so they can understand how that may relate to both prescriptions and over-the-counter medication. Let's now focus on nutrients. So nutrients are very interesting in that we obviously need to get adequate levels of nutrition so that we don't die, but there's a lot to be said around making sure we have optimal levels of nutrition. So even though now we are in the 21st century and we've learned so much about nutrition, many people are still at risk for having deficiencies of key nutrients linked to brain health. And when we don't get adequate levels of these nutrients, when we have a deficiency of this nutrient, it can lead to cognitive impairment and other symptoms of brain fog. What are some of the nutrients we really need to be paying attention to as it relates to maintenance of brain function? B vitamins. We have a role also for vitamin D, for minerals like magnesium. All of these are nutrients that actually influence brain function, but more importantly, if we're deficient, and we see this especially in the case of B vitamins, that people can actually develop overt brain-related symptoms. Who are the people who are at high risk for deficiencies for nutrients that are necessary to sustain healthy brain function? People who are eating a more limited diet, so vegans, there's definitely a reason to pay extra attention if you're a vegan because you may have inadequate levels of certain nutrients, but also people who have a significant history of GI disease or surgery because of absorption issues, and people who are high users of alcohol. There are a number of things that we learn about in medical school in terms of who is at high risk for developing nutrient deficiencies, and alcohol users are always at the top of the list. Why is that? Well, for one, they're not necessarily prioritizing a healthy diet, but alcohol can actually lead to issues with healthy absorption of multiple vitamins, and so especially as it relates to B vitamins, alcohol users, chronic alcohol abusers, are at a high risk of developing deficiency, and that can lead to symptoms of brain fog. Consideration around nutrition in general is to eat a diversity of nutrients and to eat a diversity of minimally processed foods. But if you are worried about having a nutrient deficiency, it's far better to test for that nutrient to see whether that is actually the case before you go taking giant doses of a supplement hoping that it's going to remedy your issue. So if you're concerned about a nutrient deficiency, especially if you're somebody who has had a significant GI procedure, if you're on a very restrictive diet, if you've had a lot of GI issues in the past, perhaps a GI disease. Also, if you're taking certain medications, for example, proton pump inhibitors and metformin tend to be important considerations around making us absorb less of certain vitamins. You should probably consider talking to your healthcare practitioner about whether your brain fog symptoms might be related to a nutrient deficiency. What are some other strategies that we can think about here? So, there are a number of other publications that look at additional interventions beyond just what we've described. Some of those require the care of a healthcare practitioner. For example, cognitive behavioral therapy, or CBT, when given by a psychotherapist, may actually help in certain people while by decreasing symptoms of brain fog. Similarly, certain prescription drugs that act on certain neurotransmitters may be of benefit in the right populations. On the other side of the equation, outside of the medical clinic side, the lifestyle interventions that may be helpful here. Exercise has been shown to be a very pervasive benefit across multiple aspects of research in terms of improving brain health, but it's also something that may help to explicitly target aspects of brain fog. I've also mentioned this a couple of times, but sleep and working with a practitioner to enhance quality of sleep, but also making sure that you're taking steps at home to improve your overall sleep quality, which means not looking at screens right before bed, which means trying to wind down in the hours before bed. It means having a bedroom that is at a lower temperature, which helps us to fall asleep, a more quiet bedroom, which helps us to fall asleep and stay asleep, and even improving the air quality of the room, which helps us to get good sleep, in addition to the basics of making sure your room is dark and that you're actually creating a overall scenario that optimizes for sleep quality. So, to put all of this together, there are many potential drivers of brain fog. Brain fog is not a medical diagnosis, but rather a way of describing a constellation of symptoms related to issues like trouble concentrating, issues with memory, word finding difficulties, and other more general brain related symptoms. If you're interested to keep learning more about this topic and other brain related topics, make sure you're subscribed to my channel. I'll be perpetually putting out this type of content for free to help you to learn more about your brain and to help you protect your brain now and to help to prevent brain related issues in the future as much as possible. Again, if you're concerned about significant brain-related problems, you should seek medical attention because this is more of a general informational tool. But with all of that said, I so appreciate you tuning in, and I look forward to speaking with you again soon.